Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. Today's update is a bit earlier than usual, and it will be slightly briefer due to an urgent conflict for Dr. Hinshaw, but we will be back again tomorrow. With us today, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province.
Thank you, Tom, and good afternoon, everyone. Before we begin today, I'd like to talk once again about stigma and compassion. This has been a tough year, and I know that many people have a great deal of anxiety, fear, and frustration. We continue to hear reports of communities or ethnic groups being stigmatized, and of healthcare workers or their families being singled out as uniquely contagious. We are all equally at risk. COVID-19 does not care about a person's occupation, race, or religion. It does not respect postal codes or county lines. Despite everyone's best efforts, every one of us has the potential to be exposed. The more than 75,000 Albertans who have contracted COVID-19 to date are proof of that. Every case and every outbreak is identified because people chose to care, not only about their health, but the health of their friends and neighbors. The responsible thing to do if you're feeling unwell is to stay home and get tested. And if you receive a positive test result, or if you're identified as a close contact of a COVID-19 case, to cooperate with public health and follow their instructions. The right thing to do if you find out someone has COVID-19 is to treat them with the kindness and compassion that you would want for yourself or for your loved ones if they should contract the virus. Many different areas and communities have become hotspots at some point since the pandemic began. Stigmatizing groups or individuals does not make you safer. It does create additional stress for those fighting COVID-19, and it can generate a dangerous us versus them wedge that drives a wedge between us. By singling out and discriminating against those who have the virus, we are discouraging others from getting tested and working with public health to stop the chain of transmission. In this time of the year, where caring for each other is what we celebrate, I'm asking Albertans to be caring and supportive to each other, especially those people or groups who happen to contract COVID-19 or be identified as close contacts. Turning to today's update. Over the last 24 hours, we have identified 1,566 new cases of COVID-19 and completed about 16,800 new tests. Our provincial positivity rate sits at approximately 9%, and we now have 20,163 active cases. There are 682 people in hospital, including 124 who have been admitted to the ICU. Sadly, there were 13 deaths related to COVID-19 reported to us in the last 24 hours. My heart goes out to the family and friends of all those individuals who have lost a loved one to this virus or any other cause. In schools, there are currently active alerts or outbreaks in 432 schools, or about 18% of all schools in the province. Currently, these schools have a combined total of 1,789 active cases. This number includes 113 schools on the watch list. Finally, today, I'd like to take a moment to talk about the holidays. I know the new restrictions on all indoor and outdoor social gatherings have disappointed many Albertans as we enter the holiday season. In a year filled with so many sacrifices, it seems unfair to ask for more. But as social gatherings are a leading cause of transmission, this is our only option. I have been inspired by the creativity, sense of community, and perseverance I've seen as people across our province embrace the reality of the situation and plan to make the most of it. We don't need to look any further than Hanukkah, an important holiday for people of the Jewish faith that begins this evening. Typically, this would be the beginning of 8 days spent celebrating the Festival of Lights with loved ones. But since that isn't possible this year, many groups have put plans in place for safe, meaningful celebrations that respect the public health restrictions in place. In preparation for the holiday, the Jewish Federation of Edmonton held a virtual Hanukkah cooking demonstration last week. And beginning tonight, they are hosting a virtual series of celebrations called No Menorah Lit Alone. This will make sure that everyone in their community has someone to light their menorah with and can share in the spirit of the holiday from the safety of their home. In Calgary, the Chabad Lubavitch of Alberta has created and delivered an incredible 2,500 gift boxes to bring the light of the holiday to people's homes in the city and in small communities across Alberta. These examples not only demonstrate that light can help push darkness away, they also show us that we can still enjoy the holiday season. Yes, COVID is affecting our Hanukkah, Christmas, and Kwanzaa plans, but it doesn't need to ruin the holiday, too. I'd like to hear how you're planning to celebrate safely so we can share that information with others. So as you come up with ideas, please share them with us on social media using the hashtag AlbertaCares to help others as well with creative ideas. These are challenging times, but we are all in this together and we will get through this together. Thank you, and I'm happy to take questions.
All right, we'll try and get through as many as possible. Operator, could you put through the first question, please?
Yes, thank you. The first question is from Byron Hackett, Red Deer Advocate. Please go ahead.
Hello, Dr. Hinshaw. I was just wondering if you could provide some insight into how healthcare workers in the Central Zone will get access to the vaccine. Will they have access to the first round with the 3,900 doses, or will they be at a later date? Thank you.
It's a great question, and we know that healthcare workers across the province have been working very hard to support their patients. As the Minister announced yesterday, the very first amount of doses will be allocated to Edmonton and Calgary because that is where we have the greatest number of active cases, the greatest pressure on our acute care system, and the long-term care and designated supportive living outbreaks that have been the largest with the greatest number of deaths. We are working very hard with the federal government to make plans for when subsequent doses of vaccine might be available, and we anticipate being able to roll out vaccine to other places in the province as soon as more doses arrive. And as soon as that information is available and that number has been confirmed, we will be able to share those plans.
Operator, could you put through the next question, please?
Thank you. James Keller, Globe and Mail.
Hi there, Dr. Hinshaw. The Public Health Agency of Canada says it's temporarily removing Alberta testing data from its national figures due to a discrepancy that has artificially pushed up the national positivity rate. Can you explain what the error was, how it happened, and how specifically that error would have affected that national positivity data?
I don't have details about that. We'll have to get back to you on that. I'm sorry.
James, we will follow up offline. Operator, could you put through the next question, please?
Yes, thanks. The next question is from Jesse Wisner, Global TV.
Hi, Dr. Hinshaw. We've been told more ICU beds are coming. When will the next set of beds be rolled out in Calgary and Edmonton, and how many will there be? And with this, when are we expecting to see surgeries postponed to redeploy staff in Calgary?
The details of exactly when specific numbers of additional ICU beds will come online would be something AHS would be able to provide, so we can work with AHS to get an answer to that. With respect to surgeries in Calgary Zone, what I can say from the conversations I've had with AHS is that they are working to try to offer surgeries that are needed as long as possible, and when the system begins to experience the pressure and they're looking to see what the numbers would indicate that they should anticipate in the coming weeks, that they will be making those decisions based on that forecasting, and at that point in time that they feel they need to stop doing more of the pre-scheduled non-urgent surgeries, that they would make the decision at that time. And again, AHS can provide more specific details on that.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Sammy Hudis, Post Media.
Hi, Dr. Hinshaw. Last night during a Facebook Live, Premier Kenney was asked if the new restrictions announced this week would be as bad as it would get. In his response, he said he hopes so, but if they don't work at slowing the spread of COVID in the next 4 weeks, we might face even stronger measures. So My question is, we've seen in the past that so-called half measures happen, or you yourself said the measures put in place a couple of weeks ago were unsuccessful. So why are we still taking this wait-and-see approach instead of doing the maximum possible right now to try and get where we need to be?
I think that the reality of making decisions about what kinds of restrictions are going to be sufficient to stop the spread is that we know that each of the restrictions that are put in place have other consequences and other impacts on people's health. With the suite of restrictions that were just announced this week, we know that the broad sweeping changes that have been put in place will reduce the number of close contacts that people have on a regular daily basis. We also know that the messaging that we are clearly providing to Albertans is our health system is in trouble and we need to work together to save it. And the seriousness of the situation is again underscored by the fact that one of the times of year that typically we're all celebrating with family and friends, we're not able to do that this year. And that underscores the significance of how we need to work together to bring this number down. We know that in some jurisdictions, they were able to bring their numbers down with measures that were not as strict as the ones they used in the spring. And in other jurisdictions, again, there's been a bit of a need to enhance. So we can't tell for sure what that future brings, but I do believe that these measures that are put in place will have an impact on our spread. And of course, the full impact will be up to Albertans, and we'll be watching very closely to make sure that this is going to be sufficient. Ultimately, it's in the hands of Albertans to follow all of the guidance. If all of these measures, these legally mandatory measures are followed, then the numbers will, I believe, come down.
Operator, could you put through the second last question, please?
Matt Woodman, CTV.
Hi, Dr. Hinshaw. Some of Alberta's most severe cases of COVID-19 have been in long-term care homes. I'm just curious, how will the new restrictions announced on Tuesday affect long-term care homes? Will they help? And prior to those new restrictions, was there gaps in protections for residents?
The restrictions announced last week are all about reducing the transmission that's happening in the community. What we've seen in long-term care homes is that often with the increase in community transmission, it is often people who are working in those facilities, not intentionally, but they may be infectious without knowing it. And so there can be spread inside a facility. And again, I know that the workers in those facilities are working incredibly hard under very challenging circumstances. So I just again want to emphasize that in all of our institutions such as long-term care facilities, such as schools, that what is most important is that we keep our community transmission low so that it doesn't spill over into long-term care. We have worked with operators over the past several weeks to understand how we can provide additional supports. And the question about whether or not there have been any gaps, again, I think we have, from a policy perspective, put in a series of measures to create safe environments there. But when the transmission in the community rises above a certain level, it's very, very difficult to create a barrier between those settings and the community. And so this is really something that all of us need to work together to protect those settings. We cannot draw a line between those who are vulnerable and the rest of Alberta.
Operator, could you put through the final question, please?
Thank you. Yes, the final question is from Rafi Bujikanian, CBC.
Hi, Dr. Hinshaw. I'm wondering, could you provide some clarity on what is or is not considered an elective surgery in this province right now? And the reason I'm asking is because we've spoken to the family member of someone who needs to get brain surgery and is currently being put on an indefinite wait list because of the COVID-19 related issues in hospitals, and they were surprised to find out that something as serious as that can be considered something that can be delayed. So is there any kind of, gradient to decide how much and how quickly various surgeries are being delayed or not delayed because of COVID-19?
The precise definition, again, Alberta Health Services would be able to provide that precise definition, but ultimately it has to do with the urgency of need and the whether or not the implications of having that surgery delayed are immediate or whether that person can wait for an amount of time without significant, very immediate risks to their health. So I can't, of course, speak about any particular situation or case, but we can work with AHS to get the exact definition of how they define those pre-scheduled non-urgent surgeries. What I do want to say is that cases such as the one you describe and the many, many other people who are on waiting lists underscores why the restrictions are not just about preventing COVID-19, although that is a critical element of them. They're also about ensuring that we have health system capacity to care for all Albertans' health needs. We can only do this together, and we need each other to make sure that we are bending that curve down.
Thank you all for joining us today. It was a bit brief, but Dr. Hinshaw will be back again tomorrow with another COVID-19 update. Have a safe afternoon.